Well, as always, it's a very big welcome to you all, dialing in from all around Australia and internationally as well to our Coaching Cafe. My name is Natalie Ashdown. It's a pleasure to join you all here. And today we're talking about breaking down the barriers to mental health conversations. And we are joined on the line by a very special guest, former group captain of our Air Force, Andrew Figtree. And welcome also to our resident HR specialist, Paula Jones-Hunt. Hello to you both, and thank you so much for joining me for this really important conversation.
Happy to
Thanks,
be
Nat.
here.
Yeah, great to be here, and great start leading into World Mental Health Day on the 10th, and the focus theme is the workplace. So, what better place to have a chat about it?
Yeah, fantastic. So before we begin, as always, let me acknowledge the traditional owners, the custodians on the lands on which we're all meeting today, and the land, the waters and communities of Australia, and the lands from all around the world from which you might be joining us today, either live or listening on your favourite streaming service. We pay our respects to them, to their elders, past, present, and emerging, and elders from Indigenous communities from all around the world. And as you mentioned, Figgy, we're doing these two presentations today and next week as well, in the lead up to World Mental Health Day, our focus on mental health. And today we're talking about breaking down the barriers. What's the link to coaching? I know you've got some statistics and things to share with us. And for those of you that are new to our Coaching Cafe, we are all about creating a community, having a shared learning experience, having thought-provoking conversations. We come together most Fridays or on your favorite streaming service, wherever you're listening to us, to have these thought-provoking conversations. And you can interact with us via the chat box. And of course, if you're here for your ICFC CEUs, your continuing professional development, they will be available at the end of our session if you're listening to this live. So it's wonderful to have you all here. Please feel free to pop a message into the chat box and we can pick up your conversations and your questions as you go along. And let me just say, before we do begin, we will be speaking about mental health in the workplace. As Figgy mentioned, you or someone you know might have a lived experience with mental health. Sometimes participants can find this conversation confronting, or it might cause distress. So if you do need support, we've got some information there on the screen. You can reach out to Lifeline Beyond Blue, the Suicide Callback Service, and of course call 000 if you feel like your life is in danger. So with that in mind, Figgy, as you mentioned, Thursday the 10th of October marks World Mental Health Day. The World Health Organization says it's an opportunity to build that awareness around mental health issues around the world, to mobilize the support of mental health. And yes, this year the theme is it's time to prioritize mental health in the workplace. So Figgy, you've been working with the Air Force in delivering mental health first aid programs. You've been working with Department of Veteran Affairs, delivering mental health first aid programs, and you also mentioned Emergency Health Services Australia. So perhaps you can tell us, to kick us off, you know, when you see that the World Health Organization is saying it's time to prioritize mental health in the workplace, what's your feeling about that, given all the experience you have?
It's absolutely time to prioritize it. I think if you're in management, if you're in coaching, if you're in HR, you really need to sit back and have a bit of a think about where you sit in psychosocial hazards and risk mitigation. And mental health has a huge impact in the workplace. In a 2023 study delivered to Treasury, the federal government, the Productivity Commission found that in order of the loss per or impact of mental health and suicide to the Australian economy is in the order of $70 billion. $70 billion. I mean, that is like a phenomenal sum. And just bringing it back to the workplace, of that part, about $10.8 billion per year is impacted from mental health problems around absenteeism and presenteeism. So we all have a part to play, not just as humans, but also as managers and coaches and HR people. So what we can actually do to be helping people. I guess it's really interesting that you've started off with what WHO says, and they're prioritising mental health. So what is mental health? And the World Health Organization defines mental health as a state of well-being in which an individual realizes their abilities, they can cope with the normal stresses of life, they can work productively, fruitfully, and they're able to be a contributing member of society and the community. And they're also able to engage in meaningful and also engage and sustain in meaningful and lasting relationships. So that's what good mental health is. What is actually mental illness, I guess? So mental illness is a diagnosable illness that causes major changes in how we think, how we feel, and in our behaviours. It impairs our function, our ability to be that contributing member, to work productively, to maintain relationships, and it's persistent over time. We all feel bad from time to time. So, just because you feel bad or you're anxious about an appraisal, if you're anxious about buying that house, they're normal stresses of life. It's when it lasts and for quite a period of time, and the impacts are actually starting to affect how we are able to interact with others and to live our lives. And every year, 1 in 5 Australians between the ages of 16 and 85 will experience some form of mental illness. That's every year. So 1 in 5, a little bit over 20%. The most common mental illnesses that that are seen are anxiety disorders, depressive disorders, and substance use disorders. Anxiety is around 17.2%. Depressive disorders are around 7.5%, and substance use disorders are around about the 3.3%. And there is a little bit of a gender breakdown. Females are more likely to experience anxiety and depressive disorders. That also could be because they're more willing to actually go and see a professional about it. And males are twice as likely to have a substance use disorder. And quite often the substance use disorder comes along with a depressive or an anxiety disorder. I think one of the other things that's really concerning for us is that only 1 in 2 people with a common mental illness, so anxiety, depression, or a substance use disorder, will actually go and seek professional help in any given year. So 50% of the people out there are wandering around not getting treated. Or not seeking treatment. And that's where we can actually assist in the workplace, but also with our friends, with our family. The sorts of things that we might see that might make us a little bit concerned are colleagues that just aren't getting things done. They're erratic, whereas they used to be engaging in conversations or in the tea room or at lunchtime. They're removed, they're withdrawing from others. They don't really participate in work activities or they participate to the minimum that they possibly have to. They can't concentrate. They might be indecisive. They might have difficulty with their memory. Loss of confidence is another one. They might be in conflict. So there might be anger issues where they didn't have those previously, and they might be have excessive fear or worry. They might also be making a lot more errors than you'd normally expect them to. Physically, tired, run down, eating too much, not eating, sleeping too much, not sleeping, gastrointestinal problems. These are all sorts of signs that if you just observe people, that you might think, well, actually, I think it might be time that I approached somebody and had a bit of a conversation. The sorts of areas that are driving it in the workplace are imbalanced job design, so relying on too much or expecting people to be putting in too many hours, having deadlines that are unrealistic or unnecessary or unachievable sometimes. Also, a lack of value and respect in the workplace. So just people like to be recognised. People like to say, that was a great job you did on that submission. Thank you for that. I do really appreciate it. So yeah, a lack of recognition is often a problem. Conflict, bullying, they're sorts of issues that are more higher level, but they can impact people's mental health. Occupational uncertainty. We live in a constant state of flux across the world, and any sort of change it's natural for humans to feel uncertain about that. So we as managers, as coaches, as colleagues can try and help other people around us to understand what's going on, and communication's a major key there. Look, there's lots of particular barriers to not wanting to or not having that mental health conversation. I don't know if you want to pick up on a couple, but one of the first things is like just not knowing what to say. So I think my advice to people is just say what you'd say to a mate, say what you'd say to your partner, say what you'd say to a family member that you just noticed all those sorts of signs that I just talked about. They're exhibiting those behaviours or physical impacts on their life, and ask. So just ask. And if they're going through a hard time and you're sort of not thinking or not knowing what to say, then say what you'd want someone to say to you, and that is, hey, you don't seem to be traveling so well. How have you been doing recently? And I guess this is where, as coaches, we can actually ask those good questions. So rather than closed questions like, are you okay? And are you okay is a great slogan. It's not necessarily a great question, because our natural human instinct is just to go, yeah, I'm fine. Yeah, or it's okay. So even when we're not traveling that well, very often our response is, because we don't want to burden people, we don't want to open up. And a lot of this mental health conversation stuff is about vulnerability, and I'll get to that a little bit later on. But ask those specific questions that we as coaches would want to ask to draw people into that conversation. How have you been the last week? What did you get up to on the weekend? And those can sort of, if someone goes, well, I just couldn't get out of bed. Well, that doesn't sound like you. I'm really worried about you. So empathy is really important in this. Paraphrase and reflect back. So those active listening skills that we all have as coaches are really key to a good mental health conversation and knowing what to say. Listen and communicate non-judgmentally. So don't play the person, play the behaviour. So just as I said, if someone said, how was your weekend, or what did you get up to on the weekend? And they said, I couldn't get out of bed all weekend. And you go, well, you're just lazy. I've paid the person. Whereas if you go, that's not like you. Normally you're out doing things, and I'm really worried. That doesn't seem like your normal sort of behaviour. So focus on the behaviour. You seem withdrawn. You don't normally lose your cool. What's going on? I'm worried about you. So that empathetic bit.
Go ahead, keep going, Figure. There's so much that you've shared with us, and defining what mental health is for a start. What does it look like? Who's the statistics as well? And I think when you say $7 billion, it's, as you said, it's one thing to think about the economic cost, but what's the cost to the humans? To the person, to their family, to the people around them in the workplace. That's where what you're suggesting here and the advice you're giving us is so important.
Yeah, it is, Nat. I think one thing I didn't mention in that Productivity Commission report is they also talk about $150 billion of ongoing loss and impact of health impacts to the health system, shortening of people's lives. If you look at the statistics around burden of disease, mental illness and burden of disease is the impact on the person, the impact on society, and the shortening of their lifespan, essentially. So it's equal second, I think, from memory. So you've got cancer, you've got heart attacks, so cardio type diseases, and then you've got mental health in there with that as well. So the burden of disease on society is massive. But I'd also like to just keep drawing back to that bit that it's a human thing. So not only do we have a responsibility from a productivity or a financial management perspective, but I really want to put the human face on it, because that's what mental health conversations are all about. It's actually just putting on your humanity and speaking to someone at a level that you'd want them to speak to you, or that you'd speak to a mate. And I think also that is just as reflective when we're talking about compassion for ourselves. When we're really hard on ourselves, how would we actually say, if a mate said to me, "Oh, they did this," you'd say, "Well, that's okay. Like we'll work on that, or you can fix this. It's not such a great problem." So, yeah, put on your humanity and start a conversation.
Yeah, thank you. I think that's really the message as well. And just drawing you into the conversation as well, Paula, because you've been delivering a lot of the mental health first aid programs as well. Is there any kind of barriers to conversations that you notice stand out?
Yeah, I think the one is that people aren't sure how the other person's going to respond to them. And I think I agree. It comes back to whenever I'm going to have a conversation, and I had one recently where I was able to say to someone, "I've noticed that you just don't see yourself these last couple of weeks, and I only see this person when I'm walking kids to school." So I sent a message to say, "Let's have a chat. Let's have a coffee, so we can have a chat about it," because that's what I think a friend would do. A friend would have that conversation. So it's taking it back to, I've noticed something and I'm going to have that conversation because I know you're a person. So let's have that conversation. And I think what happens is a lot of time people think they're going to get the conversation wrong and they're going to make it worse for the person. And the truth is, mostly what people need is someone to have noticed, someone to have recognized. And even if they put up barriers, because that's often what happens, and it's exactly what happened in the conversation I had, was barriers went up from the other person. I always reflect back to the fact that people take the information that they're given and think about it in all sorts of different ways. So the fact that you've had the conversation, the fact that you've raised it, it doesn't matter if right that minute there wasn't a magical solution. It's the fact that you had the conversation.
I think it's really key.
Yeah.
Well, I was going to just add in there that you had that conversation. So, and it's also a thing to keep in mind, because sometimes you're just not the right person to talk to, and that's okay as well. But when you've had that conversation, you're a good person, and you showed courage and empathy in showing up to having that conversation. So pat yourself on your back and say, well done. And I think that's important as well. And it's important also, after you've had a mental health conversation with someone, to exhibit a bit of self-care, because sometimes they're really difficult conversations. As I was talking about earlier, it requires us to show some vulnerability. Brené Brown, that fantastic social researcher, talks about vulnerability, and it's saying that vulnerability is taking an emotional risk when the outcome is uncertain, and it's only through this that we can achieve authentic connection. And that's really what mental health conversations are about: authentic connection. And it's kind of our lizard brain not wanting to suppress that vulnerability, but yeah, you will achieve connection if you are vulnerable to it.
Yeah, I'm jotting that down, thinking it's the definition, taking an emotional risk when the outcome is unknown. And as you said, and as you've said, Paula, sometimes it's the barrier is in us, like not knowing what to say. But also, I like your perspectives, both of the perspectives that are being shared here about, you might not be the right person that they want to talk to, but you are experiencing and sharing that courage as a human to actually have the conversation. And maybe they don't want to talk about it, but it's definitely worth it. And as Jenny says here on the chat, totally, wholesome and caring intentions matters. It's a lovely way of expressing it. Thank you, Jenny. And it can plant a seed in the other person's mind or their heart that someone has noticed or care, or even if they're not opening up in that moment. And I love what you said there. It's connecting, planting a seed, connecting to the heart of the person as well. Vicky, is there other barriers there that you've really noticed? I know we've talked a lot about the whole training thing and being told to come to training, but is there anything else there on the screen that stands out for you as well?
Yeah, I'll get to that in a second. I'll just sort of follow through just to round out that bit about
Please do.
We're not the right person to talk to. I think all three of us as mental health first aiders, having had mental health first aid conversations, have found that when you actually ask the question, like, this is not a normal behavior for you, I'm worried about you, the person opens up, most likely. But if they don't, that's okay. Remember what I was saying before, you're a good person and you had the courage to show up to that conversation. You chose discomfort over resentment because you don't want to be like 2 weeks down the road and thinking, oh, geez, I wish I'd really had that conversation at that time. But it's okay. If they don't want to talk to you, you're not the right person at that time. Just tell them that you're concerned, tell them that you're there for them, check back a couple of days later, a week later, just let them know the door's open, you're concerned about them. Also be sensitive to culture and gender related differences. So that might be why you're not the right person. And if I could just add a couple of resources to the ones you talked about, 1-3-Yarn is a particularly good one for Aboriginal and Torres Strait Islander people, and Q Life is another resource line that is good for people with gender related differences that might not want to have that conversation. Right time, right place, that can sometimes be an issue. And I noticed that Paula arranged to meet that person for a coffee. So I think that's really important as well, is making some time and space in the kitchen area, lunch break room, whatever. In your office is not necessarily always a good place either. I'm a big one, or I was a big one, to propose, hey, let's go for a walk at lunchtime, or do you want to go for a walk down to the cafe? Walking is really non-confrontational because we're side by side. We're just having a conversation. We're not like facing each other. It relaxes people. We're out and about getting a little bit of exercise, and it puts them at ease. So right place, right time is important. I think when you're breaking down some of the stigmas, there still is a lot of stigma around mental health and mental health conversations. And I think all three of us as mental health first aiders would just love to see a world where when I walk into a room on crutches and people go, holy dooly, what have you done? Fell down the stairs, silly me. It's just as open to go, hey, haven't seen you for a while. Where have you been? And it's like, I actually have been experiencing depression really badly, and my doctor has advised that, to take a bit of time off work, and we're working through it. I'm seeing a really good psychologist, and the difference between the two, there is no difference. One is an injury we can't see, one's an injury we can see. But I look forward to a world where we have the same compassion and openness around those conversations. And I think that, as I said, stigma is still sitting there. People are worried, particularly in the workplace, that if they talk about a mental health problem, so they go, look, I've been really anxious lately and I just can't focus on my work. They're worried that others will lose confidence in them. They're worried that they'll be seen as weak. They're worried they're going to be treated differently. Those sorts of things are concerning. So they try to self-manage, or they don't open up, and there's, that creates a whole lot of problems in itself. So I think as humans, it's good to know some of those stats that I was talking about earlier on, because you can normalize the conversation. When you say, somebody goes, well, I've been really anxious lately, or I've been seeing a psychologist about anxiety, or I'm thinking about it. It's like, hey, that's completely normal. 1 in 5, more than 20% of the population in any given year will experience mental illness. So, it's okay. Do that comparison to a physical injury with them. Connect through words, those care words of, it's okay to ask for help. Have you thought about speaking to your GP? GPs are a fantastic resource to refer people to. They might not think about that might not be their first stop when they start thinking about mental illness, but the GP is connected into psychologists, social workers, psychiatrists. It might be a physical problem that is causing the mental health problem. So they're a wonderful resource to get started. And then also maybe just offer up your support. Would you like me to help you or to support you? There are a plethora of resources if you go online. Obviously, it's online. We've got to make sure we're finding the right ones. But if you go into Beyond Blue, they've got some fantastic papers on anxiety, on depression. There are some great things on Lifeline and other resources around. We always just need to express genuine concern and empathy, non-judgmental. Are you okay? I'm listening. Be that active listener. So I guess, yeah, there's sort of some of the things that we're concerned about as far as barriers to conversations, being worried about people's reactions. I think that is where we just need to overcome that lizard brain, that concern about being vulnerable bit, and lean into the discomfort and have that conversation.
Yeah, and I think I love everything you're saying there, Figgy, because we really are showing up, I think, as our authentic self, as the person that we want to be. As the person that we want to be as leaders or as coaches or just as human beings as well. So having those conversations, as you say, they are outside our comfort zone, potentially if we're not trained or we're not really sure, but it does allow us to be authentic in the way we show up.
Yeah, look, and as you said, Paul has been delivering mental health first aid programs. I also do that, and I think they definitely give people confidence and skills in delivering or having mental health conversations. But we're also all human, so just be that vulnerable human and ask and express empathy. That's what's really, I think, about showing up to the conversation. And, if you get the opportunity within your workplace, then go and get some mental health first aid training. There's lots of workplaces, Toll, Qantas, Woolworths, University of Western Australia. There's a plethora of them that are your workplace that have taken on mental health first aid as key to looking after their people, because we're humans.
Yeah, absolutely. And what do you say there's a couple of things that in terms of the barriers that, like everybody's got a mental health issue. Like you hear it actually sometimes just like in a blasé kind of way. People say, "Oh, I've got anxiety, I'm depressed, I'm traumatized," but we're not talking about that, are we? I know we're not, but how do you respond when people kind of say, well, everybody's got a mental health issue these days, in that kind of blasé way? It kind of hurts me in the heart. But Vicky, what do you kind of think about that?
Yeah, interesting one, Nat. I guess it's situationally dependent. My initial response is if someone sort of says, I'm anxious all the time, is to start into that, put on the mental health first aider cap and start into that mental health first aid conversation. But if someone's being blasé or dismissive, it's like, everyone's got it. It's just one of those things. I would then go back to some of those statistics, because not everyone has a diagnosable mental illness. And that's that thing I was talking about before, that we all experience anxiety in the highs and lows of life. We all feel down at different times. The weight of the world gets on us, but it's when it goes for a long periods of time, it's when it impacts things, it makes us unable to function as that contributing human being within society. And I guess at the core of it, we can't dismiss the fact that somebody might actually be having suicidal thoughts. And that's where, three things, that's all you've got to remember is ask directly, keep them safe for now, and get them to professional help. And that asking directly is really, really important. In 2022, 3,249 people died in Australia from suicide. So, males are 3 times more likely. It's the 15th highest cause of death within Australia. So that's the worst case ending, or not ending, but point where, as mental health first aiders, I don't think we can be dismissive. It's like those, I guess, don't go joking about I've got a bomb in my bag at the airport, because that's really not cool.
Yeah.
So, you know, as we
Yeah.
unravel some of the stigma and become more open about mental health conversations, I think it's important that people understand that you don't go joking, or you don't be dismissive of it, that we see it as just the same equivalent as a serious physical injury. It's an illness that needs treatment, and people need help.
Yeah, I agree. And as Roberta's pointed out there too, she believes it's because people use the terms mental illness and mental health interchangeably, and they're not realizing the difference. But I think I agree with you, Figgy. I think we're past the days now where we don't take these things seriously and we joke about it, you know.
Yep.
So yeah, thank you. And that is part of the stigma reducing as well. Well, we're right on time. So we are going to come back next week. You won't be with us, Figgy, but we will come back next week and continue the conversation. Next week is World Mental Health Day. And I suppose what I want to offer everybody is, what are we doing to look after ourselves as well? Because it's one of the most important things. We have to look after ourselves so that we feel in a great space to be able to have the conversations you're describing.
Yeah, definitely. As I said, self-care after a mental health conversation is important, but it's also part of our well-being and our wellness is to maintain social contacts and conversations, to get out, get some exercise, get some sunlight, those sorts of things, to be a contributing part of society, to maintain the relationships that are important to us. They're all things that maintain our well-being. To actually have time away from work, to have some personal boundaries, that not just around work, but around family and friends as well. So you can actually look after your own well-being, because well-being is upstream of mental health problems and mental illnesses. So look after yourselves, everybody.
Yeah, it's a great reminder. Thank you. And so, yeah, we put it out there. You know, we often think about others when we're coaching. It's naturally what we do. And how do we look after ourselves? How do we do that? Is a really great reminder. Figgy, thank you for helping us with this conversation. Thank you for introducing us to what mental health is, what we should be noticing in people in the workplace, how we can approach it, you know, as humans,
You're very welcome.
go out of our comfort zone potentially, demonstrate that vulnerability, as you said. Thanks for having the conversation with us. We've got so much to learn from you, and we're all really super grateful.
Excellent. No, I love the opportunity. I'm obviously passionate about mental health. And mental health first aid.
Yeah, wonderful. Well, thank you everyone for joining us. And yeah, please look after yourself. We look forward to continuing our conversation with you next